Come tomorrow, that would be Thursday, November 18th, Korea will host its second college entrance exam amid the pandemic. And come next Monday, the academic arena nationwide will fully open its doors. For more on these events and their likely repercussions, as well as potential countermeasures, I have Professor Kim Min-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
I also have Professor Sarah Ok-shin from Korea University. Professor Shin, it's been a while.
Yeah, thank you for having me.
Meanwhile, joining the session virtually is Professor Peter Chin-hong at the University of California, San Francisco. It's a pleasure to have you back, Professor Chin-hong.
Always a pleasure, Sunny. Thank you.
Right. Professor Kim, we'll start here in the studio then. What are your prospects on the potential spread of the virus after Suneung?
Well, the Suneung itself might not be a spreading cause, even though it's a nationwide event. All the students are going to sit down and keep distance, and they're going to have a regular ventilation, and they're not going to talk or move around. So, but if the people are going to gather after the exam or outside the school, or there might be a factor, but I don't think that's going to exacerbate the situation. If we look back last year, 2020, the exam date was December 3rd, and there was a mild surge after the exam, but and it was regarded as a third wave, but it's not clear whether it's because of that exam. Maybe there was some other factors, such as Alpha variant spreading and the weather factor. Possibly there might be a mild increase after the exam if there isn't any reason related to Suneung, but regardless of this exam, I think there's a high possibility we're going to have a high surge already in this situation. Yeah.
Right, because we've had our second highest daily tally on this Wednesday.
Correct.
Professor Chin-hong, I hear the pandemic has prompted changes in college admission requirements as well as practices over in the US. Could you tell us a bit more about this, Professor Chin-hong?
Well, Sunny, I think the innovation during COVID for standardized testing and college entrance exams was probably rethinking whether or not they were necessary at all. In fact, many colleges and universities became test optional during the pandemic. They still are. Many of that policy has been extended an additional year. There was an attempt at having remote proctoring, but that was discontinued because of fears of security. Other lower stakes exams were open books. So I think we reevaluated whether or not we needed these standardized exams.
And how has that affected the application process itself? How are students responding to that, the absence of standardized tests?
Students responded very dramatically with increase in applications to individual colleges by 30 to 50%, which led to increased work by admissions officers and increased uncertainty as to what percentage of students accepted would actually go to the college that they were accepted to.
I see. Meanwhile, back on the local front, Professor Shin, 1 out of every 5 new infections in recent days involves a minor. Now, do you see the prevalence of teenage transmissions here on the local front as perhaps affecting our efforts to transition into a new normal?
Yeah, so as you know, children and teenagers spend a lot of time together in school or outside of school doing lots of different activities. So I think the increased numbers of infections in children and teenagers will inevitably rise, and the confirmed cases among general populations will also increase in numbers as well. So although the government claims that it can handle up to 500 severe cases under current medical system, the ICU bed availability in Seoul area is not so good, right? So it has surpassed over 75% threshold. So I think that the increased numbers of these infections in children and teenagers are definitely not a good sign, and it's a growing concern and potential threat for living with the COVID-19 policies.
Right, and because of that concern, Professor Kim, health authorities are now strongly recommending inoculations, COVID-19 inoculations for those aged 12 to 17. What are your thoughts?
Very difficult question. In USA, there are already more than 490 deaths in the age group from 0 to 17 because of COVID-19, and FDA authorized Pfizer vaccine for the age group 12 to 15 in a phase 3 trial, including more than 2,000 children. And CDC reports that you're going to have a 93% less chance to get hospitalized if you get vaccinated. And now they already started the program for 5 to 11 in the United States. When we look at Korea, the Korean Society of Pediatrics recommends that this vaccine is necessary for children with risk factors like diabetes, high obesity, etc. But for healthy children, what do you do with them? We need the understanding from the parents. They recommend it. But there are two factors very important in this issue. We have no fatality less than 20 in Korea. That means we have a very good quarantine measures. So, if the pediatric cases increase, we might have a similar phenomenon like the United States and other countries, and that might be a reason for vaccination. But there's data that when you screen our Korean population, the antibody positive rate is still less than 1%. And if I compare with Germany, they say the antibody positive rate in general population is between 15 to 20. So we have to think about the safety issue of this vaccination. It's not settled down yet because we don't have enough data, and all the available data are only short-term. We don't have a long-term results yet. And if you want to vaccinate for children, we have to look for more than 10 years, 20 years, even 30 years for the safety. Especially if we continue to have a zero mortality of COVID-19 in children, it's going to be very difficult to persuade the parents. The reason we have to get this vaccination done for children.
I see, and we'll touch upon that in a little bit. But first, Professor Chin-Hong, Professor Kim just touched upon very briefly about the situation over in the US. What more can you tell us about transmissions among teenagers and children there, and where authorities, of course, as Professor Kim mentioned, recently launched vaccinations for those aged 5 to 11?
Well, I agree with everything that Professor Kim said. I think in the US there were probably 3 reasons why there was a rationale for immunizing adolescents and then younger kids. A lot of it was driven by the increasing cases. And during the Delta era, more than 200% increase in cases, more than 2 million infections in the US in that age group, resulting in more than 800 hospitalizations and several hundred deaths. So I think that there was a lot of rationale for it. More than that, it also disrupted a lot of in-person schools. So more than 2,000 schools had disruptions in classes because some student was positive, and then because of contact tracing, the other students had to leave and go home and be isolated or quarantined. So that's the second. And third, there was increasing recognition that these kids would bring infection into the households, even though they wouldn't get sick themselves, but then spread it to potentially vulnerable people. So I think those are the rationales that were used. I think regardless, there was increasing fatigue and mental exhaustion as well in these kids, long COVID and multi-system inflammatory disease. All of that led to more burden of disease than we originally thought pre-Delta.
And has such rationale, the three that you mentioned, encouraged guardians to perhaps inoculate their children? What is the inoculation rate among children there?
So not high universally in the US, but about 50% uptake in adolescents aged 12 to 16. But in San Francisco Bay Area, for example, and in Marin County, just north of us, it's more than 90%. And in fact, that high adolescent rate was cited as a reason why our young kids in the unimmunized group so far at that point early in the year, there weren't any intra-school transmissions because there were so many people immunized around those 5 to 11-year-olds.
I see. Professor Shin, what now? I mean, Professor Kim has mentioned that we have not lost a life among those below the age of 20, I believe you said. Now, having said that, Professor Shin, what are the risks of severe illness then among teenagers and children here in Korea?
What other severe illnesses?
Right. Have we had any cases of children or teenagers developing critical or serious symptoms upon infection?
So as far as I know, I haven't really seen many severe cases in children or teenagers. Mostly they have asymptomatic cases, or even if they have symptoms, it's very mild. But still, there's some concerns over these children and teenagers being able to transmit the virus. So that's another.
Do you suppose the reality that we haven't had a lot of severe cases within teenagers and children, perhaps that reality is keeping our parents, our guardians that is, from inoculating their children?
Yeah, that is likely the case. And plus, I think that the government hasn't been giving out more clear message, or rather they have been a little bit passive in encouraging the parents to get the vaccination for children and teenagers. And so that might have something to do with why the parents are more hesitant over getting the vaccination for children, because of there could be possible side effects. But we still have unvaccinated groups in adults and the elderly, and we just started doing the booster shots for the elderly. And the vaccine-induced immunity is waning in general population. So I think that this children and teenager infection cases could be a trigger for the severity increase in adults.
Right. And Professor Kim, going back to something that Professor Shin mentioned, there are concerns over possible side effects with regard to mRNA vaccines, the Pfizer one that is being offered to children here on the local front. Do address these concerns for us, and also do tell us about the possible ways to tackle them, including myocarditis.
Yes. RNA vaccine is a totally new vaccine that we have, and we need long time to monitor and care about the side effects, short-term and long-term. Usually they say they have a pain on the injection site, and they have fever, and they may feel some muscle pain and fatigue. Recently, now we understand the most serious side effect is myocarditis. Usually happens after within 7 days after the second shot. So when does it happen? I think most of them seriously happen in males in their second or third decade. And the symptoms are chest pain and dyspnea, and sometimes palpitation or general weakness. So if you have this kind of symptom within 7 days of the second shot, you have to see the doctors. And actually, many patients come to outpatient clinic, emergency department. And this morning, I saw a 17-year-old student visited because of exactly those symptoms, chest pain and palpitation. And he was within 7 days of the second shot. But and actually, it was already reported as a side effect of that RNA vaccination. But when I saw him, I realized that he was having chickenpox. So people are too preoccupied with those RNA vaccines. But anyway, sometimes it is something different. Anyway, if you have myocarditis, you better stay in hospital, and they're gonna start treatment according to your symptom, and they will let your heart to rest. If it doesn't come back, they will go further for some intensive cares, but usually they recover. So even though you have myocarditis, and if you visit see the doctor within a short period, it's not that much to worry about.
Right, well, that is good to know. Professor Chin Hong, going back to your talk about losing several hundreds of lives among the young in the US to COVID-19, were most of these patients suffering from existing health conditions?
Yes, so most of them were. So if you look at the hospitalization rate in the general adolescent and children population, it's 2 to 4%. But if you add comorbidities like obesity or diabetes or congenital heart disease, it goes up to about 25%. And in fact, if you compare the hospitalization in the US and the UK, it's much higher in the US as a percentage. And several people have proposed that that reason is because there's more obesity in the US, there's more diabetes in the US compared to similar populations around the world.
I see. And Professor Shin, there is talk about a greater viral load within children patients. Could you explain this for us?
Yeah, I think you're referring to a study that just came out from Journal of Infectious Disease. So there was some interesting findings there. So many people thought that this is unapproved, but there's an assumption that children are less likely to get infected or transmit the virus. But not enough studies were done actually to look at the effect of children in viral transmission at a large scale level. And in this study, the authors have found that regardless of symptoms or disease severity, these children that are infected with COVID-19 can carry high load of virus, self-replicating viruses, that is. And that can create a potential reservoir for viral transmission and also, the evolution of the genetic variants from there. So we can learn from this study that children can have a potential to serve as new source of, spreading new infections in the community. And so, as the vaccine-induced immunity wanes in a general population, this could be a concern.
Right. Professor Kim, there are efforts here to better protect our children, and as part of one such effort, there is a requirement of vaccine passes for access to daycare centers in the country. What are your thoughts on this?
Vaccine pass was introduced to booster some general population to get vaccinated. And what is it for? I mean, for whom is it we are trying to get the children vaccination? If it's for the adults, I think we need more effort to get the elder people get vaccinated, get booster shots. And if there's a kind of discrimination between children because of that vaccine pass, we have to rethink about it. And I would like to put emphasis on the high-risk group for children, the children who must get vaccinated. They are type 1 diabetes patients and patients with high obesity and children with congenital heart disease and children with seizure disorders like epilepsy. Those are the children who must get vaccinated. Actually, it's not easy because let's say there's a child with congenital heart disease and this RNA vaccine might cause myocarditis. So they are not willing, they are reluctant, they worry a lot about their children. So it's the doctor's job to explain and persuade them to get vaccinated, because if they're gonna get COVID-19, they might end up with a severe case. And the second thing I want to say is the basic vaccinations. Children must get vaccinated. Usually they end up within 5 to 6 years, but I say that basic vaccination should not have less priority against COVID-19. If the vaccine day comes, you should get vaccinated. In USA, there's a big report about the non-COVID mortality decreased in vaccinated population. That means if you get COVID-19 vaccination, your mortality for other reasons is also lowered. What does that mean? I mean, COVID-19 vaccination is doing something non-specific good for people. So I think the basic vaccination for children is helping children getting immune. I mean, non-specific immunity is boosted. So I say that the basic vaccination is also important. You must not put priority on the COVID-19.
Right, so essentially vaccinations for all diseases are very important. For COVID-19, if you have a pre-existing health condition, you are a child, it would be advisable for you to get one.
Yes.
All right, Professor Kim, as always, thank you very much for your thoughts. Professor Chin Hong, thank you very much for your time and your thoughts. And Professor Shin here in the studio, thank you for your insights.
Thank you.
Right.